If we could, I'll call the Health and Human Services meeting to order. We have attendance Heidi Nightingale, Malco, Lydia Patty Ruffini, and Bob Shea, and myself.
Good thing there's a sign there.
Yes. I know. There's too many names there. Mike Didio and Christina Clarko have been excused.
Trisha count?
Trish is on, but she's not a committee member.
Hi, Trish.
Hi. Just listening in.
Okay. Could I get a motion to approve the June 9th minutes? Okay.
I can go second.
Great, thank you. As you see on the agenda tonight, we have no appointments, but we do have, Health and Human Services has 13 resolutions, 4 from the Health Department, 6 from the Department of Social Services, 2 were, you'll see polled, 2 from Mental Health, and there is 1 resolution on for information only. It's a heads up to what would be coming to the floor at the full ledge meeting, having to do with the appropriation of funds to $250,000 of ARPA funds for youth development. So Brenda is here, although she has no resolutions. If anyone has any questions for Brenda, if there's anything you want to add to your report, by all means, feel free.
Has everybody moved over there?
We're working on it. We're packing.
Good.
Yes, the office is
That's the
looking.
first start.
It is really great, really exciting.
Been a long
We're over
time.
there. Most of the painting's done. Flooring's going in tomorrow. So
Good.
yeah, we're making progress. That's really the only other thing I have besides what's on the report.
I do see you're working on some real strategies around getting the home health aid coverage
Yeah. So
for your ISEP cases.
the latest development, I had sent out some letters to all the local Lexus, the ones that serve this area that could possibly provide us with the PCA2 aides that could do hands-on care, which is what we're severely lacking. And I had one come back and we just had a conversation yesterday and it's looking promising.
So you'll guarantee, you'll contract with them for 35 hours a week, and they will supply an aid for you then to assign. And, then you would get the coverage that you need in lieu of, because I think, and to your credit, you're trying everything you can do to not have to hire county staff if at all possible.
Correct.
For liability and a bunch of reasons. So if this will work and this makes the deal more attractive to the licensed agency because they're getting 35 hours guaranteed, then that would be great.
Kind of a win-win.
Yep.
And really it's at this point, the only opportunity we really have other than hiring our own staff to serve those folks out in rural areas that haven't gotten served for a very long time. It's very exciting.
Great.
Thanks.
And they will all do their own transportation and,
The transportation would be, that's our vehicle.
yeah, okay.
That we have a new vehicle, it specifically was in anticipation of this possible aid coming on. So
Okay.
maybe 1 or 2, we'll see, but
Okay, that's great.
that'll be a future, I'll bring that when I have more information and we can put a resolution together. We have the funding, so it's just a matter of getting a resolution together and having them do a proposal. And we'll go from there.
And there's no issue with a contractor driving a county vehicle as long as,
Driving for whom? To do what?
well,
Sorry.
So we would be contracting with an aid agency to go out to individuals' homes out in the community.
No, as long as they're all insured.
Yep.
Basically.
so you make sure they have a current license, they have a dish, they're insured
Right.
too as well. Okay, those are the safeguards we have.
And that's our standard contract insurance certification.
Hmm.
Perfect.
Great.
All right.
Okay.
One more.
Okay.
I see that Arise has put in 8 ramps for you. That's great.
Yes.
How many more is needed? Is there a lot?
Well, that's a good question. We probably got, 18 requests, 20
Really?
requests. We're able to honor 8. Our intention is, again, with the need money, because we don't have the aides quite yet to onboard, but we're already into a new year with that money. My intention is to extend the additional contract with them for up to another 8 ramps,
Good.
depending on the price of the ramps and such. So that will be a future resolution because yes, the need is there. We have the funds and it's such an opportunity because we're investing in the equipment that can be reused over and over because we do have a storage
Good.
place. So that's something we've never had. It's really
It's a great
Thanks for
project, that's
asking.
for sure.
Yeah.
Thank you.
Anything else for Brenda? Oh, Lydia,
Elaine, can
sorry.
I ask a question?
Certainly.
She can go first.
No, Lydia could go first and then you.
Yeah,
Trish.
sure.
Okay.
Sounds good.
All right, thank you. I just want to thank you for the distribution of the coupons. I see the farmers market coupons have started. And it sounds like you had a great turnout.
Mhm.
And I know that my mother and a lot of her friends are talking about it and they're very happy.
Oh, good, good.
So thank you.
Yeah, happy to do it. It works out well. Used to be that pretty much everybody came into the building, which we ended up with probably even prior to COVID, but especially during COVID, we started doing drive-throughs and seems to be working.
Thank you.
Trish?
Yeah, Brenda, I was just curious regarding the ramps, what is the typical turnaround time for you guys when from the time you put in a referral to the time that that ramp gets installed?
So the contract went through Ledge in March. And so then it took a little bit for us to start getting some applications, probably then between the April and now, and mid-April and April and now, up to 8 of them. I got confirmation that 5 are done, 3 are in the work. So when I wrote this, I thought that all 8 were pretty much done. I'm not sure on those last 3. So I would say roughly 6 weeks. But I think part of what happens, a couple of things hold it up. One, that we have waiting for somebody to get us an application. And we have to get a doctor's statement that the person needs the ramp. The other thing is it kind of depends on their work crew, the location and the complexity of the particular ramp that needs to be done. But some are really straightforward and they can just go out and install with what they have. Other ones, sometimes the porch or it needs some modification. It might take somebody with a little more different skills. So it seems to depend a little bit on that. So they don't necessarily put them in the order we give them to them.
Okay, I didn't know if they were doing mostly metal ramps at this time or if it was a combination and whether or not there were any like supply chain issues or back orders on ramps. That was the basis for my question. But I appreciate your response on that.
I would like to add to help answer that. We were able to purchase less ramps than we had originally hoped because the prices did go up, but we were able to get those that we did order in a timely manner. When Jim came and did the presentation, part of his message was that they do hope to replace some of the metal ramps with wooden ramps. And I know that he has sent out letters to various businesses and banks and organizations asking for either monetary donations or work crews to volunteer to put some of those wooden ramps together. So that is the kind of the long-term goal, is to replace some of the metal ones with wooden ones, which then free up the metal ones for the next person that needs them.
Because in general, the metal ones are short-term use.
Correct.
And then when you realize an individual is going to need a ramp for the long haul, then the wooden ramp makes the most
It
sense.
does, yeah. They hold up better. They kind of work out a little better. That just takes manpower that right now they don't have the manpower, but hopefully they will. Yeah. Okay.
Thanks.
Thank you, Brenda.
Yeah.
Thanks a lot.
Okay. Lauren, are you planning on staying for the whole meeting?
Yeah, it doesn't matter to me. So whoever wants to do it.
Very sweet. All right, Kathleen, do you want to do your resolutions?
Another opportunity, Lauren.
It was. You can say, no, I'm going to.
You talked to your predecessor about that one.
Yeah.
Get out of here.
There's not that many. Good evening, everyone. Happy summertime. Really is right now.
Yeah.
I put a bunch of information in the summary that I included.
I try to give a little smattering of an update of various programs that we're working in. I think amongst some of the, there's the big focus on immunizations, both for COVID and back to school immunizations, and our new campaign, Our Best Shot. So hopefully we'll get some positive feedback and reaction from that. Certainly, this is the time of year environmental health services is particularly busy with opening children's camps and temporary food services and such. I think one of the areas where there's a lot of interest is the Owasco Lake watershed rules and regulations. The state has been ruminating on them for a couple of years and understandably got off task a little bit, but they're back on task. It had been vetted, the rules and regs have been vetted through 5 state agencies. It's not just the state health department, it's DEC, it's Department of State, it's Department of Environmental Conservation, and Department of Transportation, because there are all aspects of these rules that the state's very cognizant that they want to be clear that any proposed regulations do not interfere with existing state regulation. So State Department of Health has some questions that they're working with the technical work group who helped to prepare the rules and regs that were sent forward. So you can see the timeline, which is anticipated. So it's ambitious, but we're hopeful because I think everyone's anxious to move these forward. So more to come on that. The language that's in here, I think Steve Lynch shared with his committee as well. And the Owasco Lake Watershed Association is sharing it. It's language that came right from State Department of Health. So you'll see that as a consistent, because we don't want to speak on behalf of the state. So that's the latest with that. And I guess I don't really have any more updates unless someone has a question in that regard.
I'm just curious. The 9-element plan, the draft release is coming out the 25th, I think, of this month at BOCES. Once the draft 90 plan is out, then it has to go back for public comment. Are we talking about doing that kind
I'm
of?
thinking that is the public comment for that
okay.
on the 25th. And then it should just be adopted. And the 90 is kind of a little further ahead in the process of watershed rules and regulations. When the state makes determinations on the watershed rules and regulations, there will be required to be a public comment period on any edits that were made to what was proposed from, the city and the town.
The 90 hopefully will point us in the direction of where our best practices could be instituted to have the biggest effect.
It should really look at some of the sub watersheds and some of the scientifically identified manners of pollution that are in Owasco Lake. So it all is one big thing, right? To help make a healthier lake and healthier drinking water and recreation and everything that goes with it. So you're going to be hearing a lot from, not just from me. I feel like I'm focused mostly on the drinking water side of things, whereas our planning office and our Watershed Association really are taking more the lead on 9 elements and some of the other work that's going on.
Any questions for Kathleen before she gets into her resolutions?
I just percentage wise, Kathleen, of the age people, how many percentages are we vaccinated?
For COVID, I'll need to double check that. I want to say it's just about 60% of the eligible population.
Does that include the little ones?
That would include, as you know, the youngest people just became eligible for vaccination. So that would include, but you know what I can do is take a look and try to send you the link. It gives an overall, but also an age group breakdown. It still stands, and I think our oldest population is the most thoroughly vaccinated.
Thank you.
Madam Chair.
Yep.
How's that 60% rank the rest of our area, other counties?
Not very good. Yeah, we're amongst the lowest overall, which is one of the reasons why the state's encouraging campaigns to bring attention to COVID vaccination in particular. And it's constantly changing, right? We know, I'm sure each one of us here could speak to someone who's probably positive today with COVID. We like to think that it's diminished. I think the severity is less so for most people, but it's the new variants they're here. So, and we're watching what's happening around the world.
Are they like at 70, 80% or?
So our more urban areas are like downstate, New York City area are higher. I would rather get you accurate information, and I could probably do that also based on some of our other rural counties. We are often compared to the economic region. So that would be Cayuga, Cortland, Madison, Onondaga, and Oswego. Onondaga was ahead of us at one point. Cortland slightly ahead of us. Oswego and us about the same. Madison, I'm just not recalling. But it fluctuates. So we'll see.
Not horrible.
For upstate New York, I would say for our 5-county region, we are statewide, we're amongst the lowest, but for our region, there are other counties close to us.
Fair way to put it.
Yeah.
Other question? Heidi?
Now that the youngest in our population have the opportunity for vaccination, will you be doing clinics for very young children?
So that was a really great question. That was something that our Director of Community Health Services worked on for a number of months. We considered a number of factors, talked to the medical doctors, and we were listening to the state about this too. And the common practice right now is to have the very youngest children work through their pediatric office. So Nancy Purdy had some really good conversations with the hospital-owned practices. So they are starting with vaccinating their youngest children. East Hill Family Medical is getting on board with vaccinating their children, and they've identified that they will probably open it up to children not within their practice as well. So that will be a nice opportunity as well. And then I think we'll get a sense of what the demand is also for these youngest children. And like with everything, we'll reassess if we need to and see what needs to be done. But because of their age group, we don't typically, even at our non-COVID clinics, if depending on the age of the child, they have to be seen by their doctor first, or depending on the vaccine, need to have their first one administered at their doctor's office, depending what it is, because of the potential for any concerns that may arise and the comfort of the parent. And we're not set up for, to put a baby on a table.
You were saying you don't even have the medical oversight. Could you need a doctor oversight at every clinic you
Right.
hold?
We still need to
have
have
some
doctors.
reluctance
Yeah.
to oversee a pediatric
Right.
clinic.
No, it is a more challenging group to reach out to, but it's one we're watching closely, and we'll see how it goes, and we'll see what more we can do.
Okay.
Sure. Yeah. So I dropped my paper, so I'll have to look at this. So the first resolution is our request to fill 2 part-time lactation peer counselor positions within our WIC program. So they're funded entirely through the WIC grant. Elaine was doing fine print, and I did put in for the duration of the grant. And you just fill it as need be, because those 2 roles are very part-time. They're on average 10 hours a week. Their wage should be adjusted, their minimum wage right now. It's a requirement of the program, but we've had quite the revolving door of people who take those positions. They call it peer counselors for a reason, because we want to have fellow WIC recipients or someone who's had WIC experience work with the families who are interested in the peer counseling. So it really is just, it's an administrative time saver if I can have a broader amount of time to fill these positions when they vacate, because we can only have 2 at any point anyways.
I have something to say, but can we get a motion in a second?
Move it.
Second.
Okay. The only thing I had said to Kathleen is that, the whereas where the ability to continuously fill these two part-time positions whenever they may become vacant. There was a conversation that we all had about filling budgeted vacancies and why did they take a resolution? But we have made really no movement towards that. I would feel more comfortable, and I do understand your plight. But if we include this language in this resolution, I can see a lot of the departments coming in and saying, every time it's vacant, let me fill it. And so I would be comfortable asking to amend it to say, the duration of the grant as vacancies occur, or with, within a 18-month period. And then you do have some freedom, you got 18 months worth. If it turns over, you don't have to come back, but leaving it open-ended, I just think we're asking for other departments to sort of do the same. We either need to make a decision that we're not going to make resolutions for budgeted vacancies come forward, or we don't. That would just be my personal opinion. So I like to make a motion to amend this resolution to include the ability to fill within 18 months. If anyone would second that? No?
We'll second it.
Okay. All right.
No, I don't think we got a second. I think I was the first.
Oh, you
You were.
made the motion.
Yeah.
Okay, for the original resolution. Yep.
Because let me be clear, what you
Yep.
want to do is, so she doesn't come back, have to come back for those two positions, correct?
For a period of 18 months.
Yeah.
Yep.
Yeah, of course, yeah.
We voting on the amendment or on the
Yeah,
resolution?
that's what I'm confused.
Yeah. The amendment.
first.
All right,
And
all right.
Bob seconded that.
Okay, so there's, on the floor, there's HH1 with the amendment to say within 18 months, if they become vacant, they can be filled without further action of the legislature. And there was a motion and a second.
Did.
Okay, all in favor of the amendment?
Aye.
Okay, anyone opposed? Okay,
No, you gotta go back to the.
Now you
amendment.
gotta,
Now,
I think
right,
you gotta go to the
resolution.
second.
gotta vote on
As
the
amended.
resolution as amended.
okay, now I'd like to vote for the HH1 as amended. Can I get a motion and a second?
Yeah, it's already on the
You
floor.
already have that.
Okay, can, all in favor?
Aye.
Aye. Any opposed? Great, thank you.
Okay, thanks. That will be helpful. So, thanks. Our next resolution request is to fill a full-time public health nurse position vacancy within our department. It is a budgeted position. I'm bringing it back because we've been searching and our resolution expired. So I need to bring it back. It is a position we are in need of. It's very difficult to find someone to fill this position, but that doesn't mean we're not going to keep trying.
Okay, so the 6-month time period lapsed and you're just asking to fill this position that had been budgeted for as
Move
well.
it.
Okay. Anyone want it? Lydia moved it, second?
Second.
Okay. Questions, Dave?
Is there gonna be a problem filling it? Do we
Yes.
have somebody that's in,
No, we don't have anyone.
But you-
It's very challenging because
Find a
of
nurse.
public health.
right?
So nurses in general
Right.
are in great
Hard to find.
demand, as we know.
Yeah.
And public health nurses are nurses, RNs with their bachelors in nursing as well, which adds an additional element of difficulty to find it. But we really need a
Right.
position like that. Not only do we need the body, the nurse, for our general programmatic work, but we need some succession planning. We don't have a supervisor in that area. We can't have a supervisor unless we have a PHN who can do that. If a supervising PHN applied for this and they're qualified, I'm coming back to you in a heartbeat, asking to fill the supervisor position instead. But we're stagnated for,
You currently
for
have a
succession.
supervisor?
no,
Okay, how many nurses do you currently have that are full-time without
we have
part-time?
3
nurses?
RNs.
3 registered nurses.
Yes.
And they're all RNs, now,
Correct. They're all
public health
RNs.
nurses,
Correct,
degree versus non-degree.
correct.
You think, the reason I asked that, I think, is will you be able to fill it within the 6 months?
I don't know that we
So
will.
if not, you have to come back. All right.
Yeah.
Great.
And I
Good luck.
imagine,
I
yeah,
hope you
and
do.
we're gonna keep looking. I guess we'll talk more. I know that there's all sorts of conversations about personnel going on, so, you know, I don't know the right answer. We had a little bit of discussion about that last month. It's
Okay.
hard. It's very
Good luck.
difficult.
Thank you.
Yes.
Are we looking at the college, which supports a very strong nursing program?
Fortunately, we do. And we used to be more of an ongoing rotation for them, for a public health rotation. Now it's a little more, it's a shorter duration of public health rotations. They're working more on the public health side with home care agencies, which is good, but they'll come in and get some public health department exposure, and we do work closely with our contact. And so that's something. You know, when the nurses come through with RNs, at least they have a flavor and acknowledgement and awareness of RNs. You'll see, I think here also something about entering into agreements with colleges. So there's a number of bachelor's programs. And we, every time we get an intern that's from in a nursing program, we're like, hey, public health, you might like working here.
Yeah.
We try to recruit them.
Absolutely.
The college gives you the associate's degree, not the bachelor's, though,
Correct.
but you would recruit from our college if you.
Oh, absolutely. Yes, for sure.
And just to answer Lydia's question, I was at the graduation, I think you all know, out of 30 graduates, 4 stayed in Cayuga County,
For state.
4 stayed in Cayuga County. Which means probably the other places are paying more. That's my opinion. I mean, it's not fact, but I don't know why else. And there's a lot of them that aren't from our county too. Naturally, maybe they're from other counties and they went to their hospitals or their jobs in their county, but that's not a lot of big percentage.
Wow. And
Yeah.
Kelly King, it's Kelly King, right?
Mhm.
She really does some creative things with hiring. Have you guys partnered with her?
You know, not too much. We certainly have spoken with her, but we really haven't asked her specifically about nurses, bachelor's prepared nurses, but I'll certainly reach out to her and see what thoughts she has. Absolutely.
Okay. We vote on this resolution,
No.
Not yet.
but we got a motion and a second. Okay, all in favor of allowing her to attempt to recruit and hire a public health nurse? Aye. No one opposed? Great.
The third resolution is to enter into agreements with colleges for interns, be they nurses, public health rotations, various ones. And there are programs that require that. And We've had some great success actually, indeed, bringing in people to work part of our intern program.
Very perfect.
Second it.
Okay, all right, great. All in favor?
Aye.
Aye.
And then our last resolution is to accept the funding for a public health preparedness contract. We get, it's 5-year term, but we get new money each year, so we have to accept new money each year. And this is, this is a grant that we've had for about probably close to 20 years now.
Motion,
Move it.
second.
Nightingale, second.
All right, all in favor?
Aye.
Thanks.
Okay.
Thanks, Catherine.
Christine, if you don't mind, I'll let Lauren go with her 2 resolutions.
I don't mind.
Okay.
Who else can we put in front of Christine?
I know. He has too many.
Okay, so the first one is about the creation and filling of a full-time psychiatric nurse practitioner. And there's a few reasons for that. One of our contracted psychiatrists just left. So I'm looking to, instead of refilling that contracted position, but to create a full-time nurse practitioner position for a few reasons. Our visits continue to grow. Our caseloads up for our prescribers are very high, and the salary or the amount that we would pay out would be almost exactly the same for a full-time nurse practitioner versus a part-time psychiatrist. So we would be getting someone who could work 35 hours a week and see more patients by creating this full-time position than filling that psychiatrist position. And they can do the same exact thing in their sessions as far as prescribing medications to people. So That also will be helpful as well, because one of our nurse practitioners is going to be, you've heard me talk about the medicated assisted treatment at the jail. That could potentially she could be out there a little bit more time than she is now. So that would also help cover some of her time at the clinic too. So the other thing is that as far as revenue goes, the part-time psychiatrist brings in about 50% of their salary and revenue, and a nurse practitioner would bring closer to 75% or 80% of the revenue would come in for their salary. So that's my case for a full-time nurse practitioner.
They do more billable hours.
Yes.
And based on what you pay the person.
Yeah, so a psychiatrist is significantly more money to pay for, and they were only contracted for 17 hours per week. So this would be a full-time nurse practitioner for 35 hours a week, giving us a lot more hours to bill as well.
I want to make a motion for
Move
EJ
it.
13.
Yeah, that's easy.
Question? Any questions?
Yes,
Go ahead, Dave.
I did the same question I asked Kathleen. Is it going to be hard to fill this?
I think it might be easier to fill a full-time position versus a contracted position. Just, we got lucky with the last contracted nurse practitioner position filled. So I think it might be okay. I hope.
It's just, they're hard to
I
find.
know. I hope.
You pay a pretty competitive wage, though.
Yes, we do.
For like
For this-
$100 and some odd thousand.
Yes, we do.
It's a very more competitive than the nursing wage. I'm
Good.
sure.
For sure. That's not right. Yes,
Right.
thank you.
Yes, well.
Okay, all in favor?
Aye.
Okay.
And then the second one is just the Oasis money for the state aid money came in with the adjusted rates, and it's a little bit higher than, so it's about just adjusting the budget for that.
Okay, motion?
Yep.
Second?
Like, go.
And basically, you make the decision, or there's buckets where you can invest these additional dollars, like one's going, you make one's to Chad, one's to
So
Unity
basically,
House.
so all of these agencies receive the state aid
Yeah.
funding. So with it's the cost of living adjustments. So we just distribute that based on the amount of money they get. We add that to it for them.
You have more agencies that you give money to, but these two are up for this,
Yeah.
the COLA.
Mhm.
Okay.
We already got the OMH money. This is the Oasis money that came in.
Oh, okay, gotcha. All right. All in favor?
Aye.
Aye.
You get to be the bearer of good
Great.
community house and Chad.
I know I didn't put, I was on vacation, so I didn't send in some updates, but I just wanted to say we're working with the sheriff on a number of projects. The medication assisted treatment at the jail looks like that's getting closer and closer to a go. We're going to start with the people that are coming into the jail that are already on those medications first and sort of work out the process. And that will give us a little bit of time before the October 1 mandate for all inmates to be offered the medication assisted treatment for substance use disorders. We're also working on a school threat assessment team with the sheriff. So we have some people from mental health, superintendents, as well as people from the sheriff's department working on that. And hopefully we'll be able to put a good team of people together before the school year starts to be able to respond and assess for any school threats that would occur. So that we have a system in place where we can reach out to the families and the people and do a thorough assessment along with law enforcement.
The program at the jail, does it, Adam Duckett have to approve everything that goes?
So he's involved in all of their conversations.
And he has to
around that.
approve it because he is the jail.
Medical director at the jail.
Great.
Yep.
Thank you.
He doesn't direct it though, or?
He is the medical director at the jail, and he's part of all of our conversations. So between our prescriber, who is already doing existing hours at the jail, we work really closely with him and his team as well.
Thank you.
I asked Ryan, if there was 131 inmates in the jail, is there any sense of how many individuals will be offered or be taking medication for opioid use disorder? I mean, is there a sense?
I want to say right now there might only be one person that's on it currently, or that was when they came in, but I don't know what the number is going to look like. It's gonna be really hard because at any given time it could be different.
But you're going to reach out to people who have an addiction problem and offer it?
Yeah, so the mandate is that every inmate or anybody who has a substance use disorder is able to access medication assisted treatment without any sort
So
of.
you screen, people
Yes.
will get screened for their potential need.
Yeah, so that's what we're working on now is the whole assessment process and the whole entire kind of that process first before. So that's still in the works.
And the $100,000 that you got is to help offset the cost of the medications and maybe staffing. I mean,
Yeah, medication, and I believe the psychiatry hours were part of that plan. And then there's going to be other money too that me and Brian will discuss kind of what we want to do with that.
because the nurse practitioner who's ever writing the order is working under the psychiatrist. Where they're,
So we take care of the psychiatry at the jail as mental health. So we
Yeah.
have a psychiatrist and a nurse practitioner out there.
Yep.
Dr. Duckett obviously is the medical
Medical.
director for the entire jail. So they work very closely with him, as well as we do have a social worker from
Yeah.
mental health placed at the jail too. So they work really closely together for all the psychiatric needs at the jail. So they're all part of this process as far as assessing and being able to figure out who is in need of this medication.
Dr. Duckett can order these medications as well.
He can as well.
Yep.
Yes.
Lauren, just so everybody's clear, this is a volunteer. They can't be mandated. The inmates cannot be mandated to be part of this program. It's all volunteer, right?
Yes, it's mandated that it has to be offered.
Offered,
Yes.
but they don't
If-
have to.
if- Right, they could say, no, I do not want that.
Thank you.
And when they get discharged, they go home with a referral to continue out and all of that. It's just so that people don't have to come into the jail who have been on
Go
treatment.
through
and-
withdrawal and be
And relapse or.
Yes, not offer the medication and then leave the jail without any plan. Yeah, so. Yep, so we're real close to getting that started, so.
And
we're
he
excited
has-
about it.
Sheriff has sung your praises every
Yes.
meeting
Mhm.
about the
Yes.
collaboration and the working
Absolutely.
together.
100%.
That's good to hear.
Yep.
And then as far as mobile crisis, we've had 6 applicants for the case manager position, so we're starting interviews. And we just finally received, I think we have 2 applicants for the social work position, so they still have to go through civil service, but that's hopeful. So hopefully, once we hire for the social work position, we can get things rolling for mobile crisis daytime.
We're betting woman, what would you say?
2 months.
2 months from now, you'll have a mobile team.
Yes. That includes the time for training and figuring out the schedules and whatnot too. So I'm hopeful. It's close.
Great.
Yes.
Thank you. Any other
Okay.
questions?
Great job.
Thank you.
Thank you.
Okay, Christine. Yeah. Save the best to last. How's that? She likes you guys too.
Okay, so I have 6 resolutions, two that you can see were pulled, and I can talk a little bit about kind of that why that happened when do you want me to speak first?
Yeah, HH5. Oh,
But I'll start with the
Yeah.
resolutions, okay. So HH5, we were approached by the Auburn Community Hospital to enter into an memorandum of understanding, an MOU around, there is really stemmed from their wanting to be able to apply for federal funding, this 340B program, to be able to receive medication at a substantially discounted price compared to, typical costs. So in order for them to apply for that funding, my understanding is that they have to show the government that they have this memorandum of understanding with the county, with government, so that they can, hopefully apply and receive that funding. There was one done in 2016 with Ray, and I'm not sure kind of how it came about that they decided that because, I'm in as the commissioner now, that they needed to
update the MOU.
update, and have me on the form. So
Yep.
we have that on as a resolution.
Make a motion, somebody?
Yeah.
Second? Okay, all in favor?
Aye.
No questions? All right, great. HH6 is accepting $25,000 from OTDA to enter into a contract with Cayuga Community Action Program. You've done this before for DV
Yes,
services?
so every year we, for a number of years, we receive an allocation of $25,000 to be used specifically for emergency services for TANF eligible families that are in receipt of domestic violence services. So we have a plan with CAP that we enter into and have entered into that talks about the type of services that they will provide with the $25,000.
And a little bit of case management hours is also incorporated into that.
Move it. Okay, second.
Second.
Okay, all in favor?
Aye.
Okay, the next is a contract renewal with CAP for rapid rehousing case management.
So this is budgeted. This is a renewal of a contract that we've had with them for a number of years as well. Again, it's for TANF eligible families who are experiencing need for housing. So they're involved in housing emergency services, and case management is really to help them look at, what's driving that emergency, look at employability, look at trying to like stabilize them with, whatever areas are kind of, helping to contribute to them, being in this position at this time.
That's 100% federal, state and federal funded.
It's 100% federal funded through the FFS.
Yeah, great. Second?
Second.
Okay. Questions or any questions? All right, all in favor?
Aye.
Okay,
HH8 is for us to contract with Cayuga Centers for Diversion Case Management Services. So this was something that has really been in the works since last year when we developed our budget for this year. We set aside money in our budget for this program. We did an RFP process in late spring, and so based on that RFP, we would like to contract with Cayuga Centers to provide this case management services to youth that are aged 12, 13, 14, and 15 that are involved in the juvenile justice system through probation. They have committed some sort of crime that if they were of the age to be able to be charged with a crime, they would be in the legal system. But because they're youth, they are able to receive diversion services or probation services. So we're looking to target the youth that are eligible to receive diversion. And that determination of the diversion services is made by probation. So the referrals would come through probation, the intake would be done with probation, and then they would refer these youth to this program through the department. And they would provide case management services to try to support them and their families, to try to prevent them from further penetrating the juvenile justice system. It would help the families, help the youth, but also it would save us some money, we believe, by reducing some detention costs. Those are very expensive, upwards of $800 to $900 per day for detention costs for youth, or a placement for youth, which if it's a residential placement can be, incredibly expensive, 12, 13, 14,000 a month.
I just got a question.
Yeah, sure.
What was the age?
12-year-old, 13, 14, and 15.
So what are we, at HA7?
Time for question after we move and
yeah,
second.
get it. I'll second it.
Yeah, I'm sorry.
That's all right. I second it. Now you have a question.
No, it's just, okay, I just want to know the age, that's all.
Yeah. And the 16, because of race, 16, 17, and 18 still be handled by.
So 16 and 17-year-olds are the raise the age youth
Yeah.
that also can receive services that we don't have very many of them.
Right.
That was, that's how it turned out, that we don't have a department, doesn't work with a lot of the 16 and 17-year-olds. They can certainly receive services in the community as well. They're eligible for the same type of services through the community. We're trying to target the JD youth here.
Right.
That, probation is working with right now, and, they, by taking these referrals from probation, it's going to free them up to do some more intensive work with the youth that have to be on their caseload, that are actually on probation, placed on probation by the judge. And so we think that this will help to, help the children that are on the probation caseload by getting some more intensive services from their juvenile probation officer. And then
Some of these kids may not be on probation. They may just be
diversion eligible.
right. They're diversion eligible.
Diversion
And
eligible.
you want to help make that successful so they don't end up in court and end up in court and placed in detention or
Could be right.
worse. Okay. And that helps your budget too, because the detention costs are
Yeah,
paid
if we
for
can
by-
save one, if this program is successful in saving one child from, coming in to a placement that has to go residential, then we'll have saved our money. Paid our money.
Okay, and I know Ray had talked about this last year, trying to work with the probation department more closely to get their, to get some preventive hands around these cases.
Correct. And I've talked to Jay through the process, through the RFP process. I just checked in with him a few days ago and just talked to him a little bit more about coming in tonight and, checking with where they were. Their juvenile probation officer's caseload is almost double the other probation officer's caseload. So they are booming. He said that's even lower than it was during the height of COVID. So it's coming down, but he doesn't see it really moving down more significantly. So,
What
it really
can you do when your caseload's that high?
right. So it's more just trying to be more intensive and provide really good quality services to these families, to try to make a difference while we have that opportunity.
Okay, more questions? Olivia?
I think you were first, right?
Well, she answered my question. This all goes from family court first, then probation, right?
The other way around.
Not necessarily.
Kind of avoid family court, right?
How do they get probation if they didn't go to court?
The family or the school goes to probation
Through
and
JD, through JD. Well, so I don't think they necessarily make it into court first. I think it goes right to probation.
Okay.
The referral goes to probation and they have to do the intake with the youth.
Is there family court judge involved in this at all?
They can be, and some of the referrals could come through the family court judge, but not all of them.
Thanks, Kristen. Yeah, all right, thanks.
Can you explain to me, a non-knowing person, a lay person, what do you mean by diversion eligible?
So diversion eligible means that what the child did, the issues that are happening in the assessment of the probation department, and they do a youth assessment to see, I think, the category of risk, a reoffense, and severity of what's happening. If they meet the criteria for diversion, it means that they believe that there would be potential success in having them participate in services in the community, having the child participate in the services and the family participate in the services to try to, I don't want to say the word rehabilitate, but in some ways to make a change that will be successful to take the child down another path so that they don't, further penetrate into the system. They're already at that door. We don't want to get them further in. We want to try to back it up so that they can make better decisions, be hooked up to community services, supports, get into pro-social events, try to build up, some positive things for them so that they start to make better decisions and support the family.
so they didn't murder someone or burglarize.
No.
The lower level
Yeah.
Yeah.
kids that are charged with a
Yes.
crime.
That are believed to, that they would have success in participating in the program.
Thank you.
Heidi?
When you talked with Jay, did he give you an anticipated number? Did he analyze that caseload that the JD probation officer has so that the
would-
centers kind of has an anticipated number of kids who might be referred?
I was thinking that too, because will there be a wait list for this
Yeah.
program?
Right.
I think that at the beginning, if we have permission to move forward, I think that, there definitely will be youth that can be referred their way. I can't remember off the top of my head what the actual caseload for the case manager is, but I believe it's probably in the area of 12 to 15 youth at one time that they'll work with. So, and then youth will come off and then there'll be other referrals made. And when we talked before, we talked about really targeting specific youth that we think will most benefit from this. If there is a pool of children, the other children will still be able to receive services through probation. So they're not going to be left without services, but there will be a subset of them that will be referred to this program. And, I think that's where we're going to work together to see, and talk about like who are the first ones that should come in, who have been very challenging for them, who do we think is like really ready to work, what parents have been really talking to them more about, like we need some help here. So that's our goal.
But in order to go into court, probation has to be back involved
Oh,
to
yes.
get to court.
Yes.
So they're sort of overseeing what's
Yeah,
happening.
they still have, and Jay said this, the probation still has statutory regulations that still must be followed and will be followed even if we implement this program for these youth.
It'll be interesting to see how well it does.
Yeah, we're excited about it.
Great. Any other questions? Go ahead.
Are we offering any other diversion services
So
in
yes,
the county?
Yes.
Which other diversion?
so
services?
PINS diversion. So if there's children that are have pin site behavior person need a supervision, not at the JD level, where there's some sort of a, crime type behavior being committed, for youth that are just really struggling. We know they're at risk. They're being very challenging at school, at home, in the community, that they can receive diversion as well. And so those go through the FAST, at mental health.
They're not crimes, they're incorrigible youth or their
Incorrigible,
behaviors.
inoperable.
Yeah,
Yep.
yeah.
Truant.
Okay, all in favor of this program?
Aye.
All right. Thank you. 9 was pulled.
9 was pulled.
Okay,
10 is for us to enter into, not to enter into a contract, for us to hire, for seasonal heat clerks here at the department. This is a contract, I keep saying contract, we'll be bringing that in next month. We do this every year to bring in seasonal workers to help us manage the volume of work that comes in when the heating season begins. So we're just, in my report, I said that the cooling season ended in July, and then September we'll be starting with the heating season.
these are 6-month employees or.
6 month.
Yeah.
And we have a group of folks that are trained, they're willing to come back. And so we're going to stagger them out so that we can, cover the volume of work that comes in. And next month, I will have a resolution to enter into a contract to hire the staff at CAP. To do the outreach and take in the applications and really get a lot of that paperwork ready for us so that it can come here, we can review the paperwork and make the payments out to the vendors.
Move it. Second, I'll second it. Right, all in
I
favor?
have a question.
Okay.
Before we go, sure. Is this budgeted?
Yeah, we have a budget for heat.
Thank you. And it's 100%.
Yep, 100%.
Yeah.
100% covered for those positions, absolutely.
Okay, all in favor? Yes. Yes. Okay, all right. You pulled 12 too?
I have 11.
Oh, 11, sorry, go ahead.
So 11 is for us to fill a caseworker position in the child welfare area of services. That we had a caseworker that resigned, hadn't been here very long, and decided that this wasn't for her. So
This wasn't the one that was fully trained and went to a different Sligo.
That was a different one.
This is one that just said, this isn't the job
Yep.
for me.
So we're asking to fill. We are having some. I don't want to say issues, but we're having struggles like everyone with, trying to find folks to take positions. We have 22 of 25 caseworkers filled right now. And we only have 4 names on the certification list. Two of them have already declined, and 2 of them we have to evaluate to see if we think that they would be able to be successful. So that's a very small pool for us, and we're at the actual bottom of the list as far as the test scores.
And this is continual recruitment.
Yes, this is
right?
with continual recruitment. We're really struggling. The good thing is that we do have 3 fully trained caseworkers ready to go to start cases, taking cases, and doing that work. So that's a good thing. So that'll be a little bit of relief, but it does seem to be this kind of revolving door of folks leaving and us trying to get people up and trained and find folks to take the positions. So it is definitely an ongoing concern of ours.
Can I get a motion for HH 11?
I can give a second.
Budgeted, you want to fill the vacancy?
Yep.
All in favor?
Aye.
Great.
So just to mention a little bit, because 9 and 10 are on here as being pulled. We have a meeting tomorrow with Don Carr to talk a little bit about the process that we should take pertaining to hiring and interpreting service. It just so happened that my department and another department also had a
Probation
resolution
just.
on,
Yep.
and they
just
pulled the
it.
resolution. So it just sort of was coincidental that they were looking to contract for interpreting services, and that led to a larger conversation around, like, is there something that we should be doing different to try to engage a vendor, get a better price? So we got in touch with Don, and we're having a meeting with him tomorrow to talk about the best way to handle interpreting services that are by phone, which is through language line that we use right now. And then also in person, because we do have instances where a telephone conversation isn't sufficient. And we need to really have a face-to-face conversation with somebody that doesn't speak English, and other departments have that need as well. I think Kathleen's talked about that sometimes. So just trying to figure out like what's the best way within the purchasing policy of the county to make that happen most efficiently.
He may put an RFP out and then departments that use it.
It may come to that. I'm not sure. So more to come on that.
Right.
And then we're going to have a conversation with him as well about the process service, because we have the need to serve a lot of court documents to folks in the county and also out of the county. And we had put in a resolution to enter into an agreement with a few different people. But after thinking about the conversation with interpreting, we're thinking that we want to bring Don into that conversation as well. You know, should that be an RFP process? Depends on how much money we're spending. We're actually spending considerably more money than we have in the past for serving papers because of some changes with the court around who needs to be served. So more folks are getting served papers than had before. We also have a high volume of cases in court, and that will spike our numbers too with how many families are needing to be served the paperwork for court dates and such.
And I know the sheriff just spoke to Kathleen about the difficulty of using the sheriff's department to do the service through for environmental health because of his staffing issues. So
Yeah.
same thing, you have the same need.
Yeah, so we have folks that want to do it for us, so I don't think we're going to be okay with having people do it. My concern is that I don't think that it can be necessarily one person. So that's what we want to talk to him about. If we can have a pool of people, what does that look like?
So you just do a purchase order instead of a contract?
So we're gonna work that through.
Okay. Dave?
Do you think both of those, the ones that were pulled, HH 9 and 12, will be on next month's?
That depends on what
How you make out?
how we make out tomorrow. If it has to be an RFP process, I don't think we'll be back for a few months. If it's, I'm not sure. So potentially, but I guess I can't speak to that.
The only reason is people have been asking me about both. So it'll be, eventually they'll be on the docket.
Because in the interim, you're still going to serve people. You're just going to use whatever you got right now.
And in the intro, it's really, it's something that we have to do. So in the interim, we will still be serving, we'll be doing a PO. But we want to make sure that we're doing and following the procedure.
Understand. Thanks. Thank you very much.
Okay. Anything else from your report you want to talk about?
So our emergency housing numbers have gone down again, which is good news. We still do have quite a few folks that we are, providing emergency housing for, so that continues to be a challenge. I think things in the works to try to help meet that need and to do better and do things differently. I think there's been some conversation, that you've been involved in, lately around the movement with Housing Vision. So we're hoping that that looks like that's on the right track now. And Trish is on, to see that, moving forward. We're continuing to provide the case management, trying to move things along. I think that, the good thing is that, we are finding, and helping people find success in finding housing and moving them out. So that's happening and we're doing well with that.
Yep, great.
And one more question. Elaine and I talked and Trish talked yesterday about the Chapel House and Housing Solutions. I got an email late this afternoon that's been settled.
Right. And
So
basically,
that's a darn good thing.
in order for all of this to have worked, Chapel House had to accept the purchase offer, or Housing Visions has to take the property, and it looks like that's going to happen. And
But they're right. They've settled on something that's acceptable to both.
Yep.
James Breslin emailed me late and said it's all taken care of.
Yep.
So we don't need that meeting.
Right.
Good.
Yep.
Thank you very much. And I'm glad that they got this straight. Thank you.
Okay. Okay. There is. We're done with you. Unless you want to talk. You're her favorite. Thanks, Christine. There is, you see on the agenda, alleged resolution, and just like we did, I think last month, this alleged resolution is not really to be voted on by this committee, but It's for information of a resolution that's going to be coming forward on the floor. It has to do with making a allocation to the 250,000 for actually for youth development. And I think you were instrumental, Heidi, in getting some of this worked on and written. And I mean, basically, the intent is to bring this to the floor of the legislature.
Right. I think the important things I'd like to mention about it is it's $250,000 that will stay in the county, that will stay in a department, the Youth Bureau. And it comes at a time that will invigorate the Youth Bureau when we're in a hiring process for a brand new Youth Bureau director. And once the director's on board, he or she will identify, do assessments, identify areas of need, programming opportunities, and then come to us at the legislature for us to approve appropriations for various programs.
And I think Bob had a question about the last whereas. Funds to invigorate the opportunity for youth development across the county to be overseen by the incoming full-time youth bureau. No, not that one. Which
Next
one? It's the what?
Last one,
The last whereas.
last resolve.
Yes, I don't know what I have here.
It's updated.
Yes, it's been updated.
Yeah.
Yes, I
It's
looked at it.
resolved and updated.
And it had to do with the allowing the money to be carried forward into the next year's budget if it's not all expended.
Correct.
Not that it's going to be an annual give of 250,000.
Right. The carry forward is specifically with Chris on this. If we don't mention carry forward and they don't use the $250,000, which is very unlikely with a new director and between now and December 31st, that budget would have to go to zero and these funds would go into general fund. So it allows the language there allows us to move the ARPA funds in that budget line from one year to another until they're exhausted. This original amount.
Question, Eli?
Rich?
Yeah, just if it's coming out of ARPA, there is a deadline for when they do have to be expended. I forget what the deadline.
2006.
26.
Or 26.
Yeah,
I
2020.
don't think you gotta worry about that.
Right. But that's a good point. They have to be committed by a certain point, spent
24.
by the 26th.
Right.
Okay.
Okay.
And through that was your question, right?
Does this count as committed?
Well, this is just, we're not voting on it. We're just discussing it and
When we do, will that
yes. Will that what?
count as committed to the youth
Yes,
direct
yes,
program?
yep. If it passes.
I've been working a little bit with Heidi. Heidi's done 90% of this and I know Trish has been working on it. And I think you have too. And I'm fully 100% behind this. I will certainly be voting yes for this.
Lydia has been a big.
And Lydia too,
proponent,
she's on the
too,
committee, I
of
forgot.
Investment in our youth.
That was my question, but I'll wait until Brian goes.
Couple questions. One is, I'm in support of this. I don't see the funds being there for, up to being an issue with the ARPA money because of the fact that somebody who's ran youth programs is very light for the whole county. But I do think this is a great seed to start because when you're when you run these programs, I've always feel like they're typically city and not outside the city. So our county's big, and I think this is great. How are we doing with the hiring process? Is there a pool of candidates? When is that pool at? Like when do we end the portal to enter for applications?
Do you know the answer? to
I
that?
actually talked with Diane today.
Okay, great.
And she does have applicants. She's waiting another week to 2, however, just to increase the pool because the pool's pretty light. She said.
Yeah, I think I pushed just about every applicant I knew just throughout my just being in this world. I say, hey, you might want to apply. So I applaud this effort.
And again, we have a great committee that Lydia's on and Heidi and Trish.
My question is, how come my name's not in the buy?
Because this is being, we'd be happy to do it. This is being presented as a Democratic caucus resolution.
So it's a partisan effort rather than a bipartisan effort. And to me, that's a little disappointing considering the amount of effort and commitment that I've made.
Heidi and I just spoke about that
Right.
earlier today, that this was coming initially from the Democratic caucus, but point well taken. You've been a big proponent of this, so look at that.
And that should be changed before the full ledge meeting.
Yeah.
Okay.
Yeah, we've got time for that.
Yep.
Yep.
We did talk about it just now, yep. Okay, and Trish, you are also working on a ledge resolution. We spoke of one last month, I think, about to the nonprofits. You
Yes.
had some bipartisan conversation and you're looking at making some amendments to that and bringing that to the floor.
Yeah, I did make some amendments to that based on the feedback that I got from various legislators. And I do appreciate having direct communication with the Republican caucus on that resolution. And to Lydia's point, anybody that wants to add their name to that resolution, I have no concerns with that. I think it's great to have bipartisan support on these things. We did amend the amount requested down to $500,000, 500,000, which is mirrors what this body approved for our small business community as well. So kind of wanted to fund at a similar level for that. There was some conversation about making sure that we're looking countywide at the needs of the community and the needs of our nonprofits. What the language I added in there pertains to the committee structure of having a representative from both caucuses and also geographical representation from the county, perhaps, is a way to address that. Definitely doesn't have to be that way, but I thought if we could look at having a community at large member from the north, from the south, and maybe from the central part of the county, that might help to address some of the concerns of making sure that we are really thinking holistically about the whole county. The revisions were sent to our county attorney, and Dave, I think I copied you on that as well.
You did.
And I did touch base with Hans today to see if we could run that through Ways and Means, or if he prefers it to be a legislative resolution. So that's pending, but it is in the works. And just in some conversations I've had with various folks, I think there's a lot of different opportunities out there for nonprofit support to look at even expansion of some of our services out into the rural areas for healthcare. And it'll be interesting to see. Obviously, there would need to be a process established, the committee appointed, similar to what's happening right now with the small businesses. But I do think that there's some really exciting, viable projects that we could be looking at through that funding. So that's where it stands right now. If anybody has questions, I'm happy to answer as best as I can on that.
Yeah, Trish, I have two. What was Hans's answer? Does he want it Ways and Means or the full edge? And the second, have you talked to Lynn about, this is coming out of ARPA, about we have the money still in there, some money in ARPA, so you just want to make sure that that's covered.
Yeah, and actually, I'll copy Lynn on that, Dave. That's a good point. I'm not sure she was on the communication today to the attorneys, but she certainly weighed in on the initial resolution. that we looked at in June. So I'll make sure she has the most current version and she can compare that to what we have in the budget remaining for ARPA. And Hans was going to take it into consideration, and I just asked him to please keep me in the loop in terms of once he has a chance to read that resolution and look at it, what his thoughts are around that.
Thank you. Thank you very much.
Yep.
Heidi?
Dave makes a good point about what we have available. Dave, are we able to get an updated list of expended funds?
Absolutely. I'll send it to all the legislators tomorrow.
Thanks, Trish.
Thanks.
Do we have any other business for tonight?
No.
Motion to adjourn?
No.
Second? All right, thanks.
Thank you, everybody. Great job, ladies.